we're live. There we go. Hello, hello, Dr. Rich Castellano, the Smile Doctor, here today with Tracy. Thank you so much for letting us share your video today. So exciting. Yeah, we're going to be doing some of the Bellafill. Tracy has done the lift. Let me just show you this here. So proud of our results. I'll bring this over to you so you can see that looks great, looks natural. And what we really love about Tracy, she has some of the best energy. You have such great, and thank you. We make sure you got to make sure Tracy's on camera, don't we? That's where the action is, so make sure. She has some of the best energy. There you go.
Yes.
And we're so grateful. We have the best patients. So for today, we've marked out with our little white pencil, we're going to be using the Bellafill. We're going to be doing an intradermal injection to thicken the skin, and we're also doing subcutaneous, subdermal, to elevate because we get a little deflated. Can you make a big smile for me? Big smile. See, the volume looks good. Now relax as best you can. We lose the bone and the bony jawline, so we're going to work on all of these areas. Any questions before we get started?
No, Dr. Richard.
Very good. Okay, we were just talking a moment ago, and Tracy, she's such a leader at her work. She was talking about she went into the break room, and everybody was down like this. And what did you do when you came in, when you saw them?
I said, hello, hello everybody. And everybody's like, oh, yeah. Yes.
Right, is that good? You want to look more forward, backward, or is that
No,
good?
that's perfect.
But she's always bringing the energy up. And so we love it when you come here because you're bringing our energy up too. So I'm going to do a little cleanse. This is the HIBA cleanse here. And Brittany has everything set up so perfectly for me. We have the best team. I was just at a meeting in Las Vegas and got to see all these amazing doctors. And one of the things I really recognize is when I heard them talking about their teams, they usually didn't brag on their team the way we brag on our team. I love our team. They're so good. They make such a difference.
I do.
Yeah. Tracy loves them too. If Tracy loves them, that says a lot because they are really great people. So now that I've done the alcohol and I've done the HIBA cleanse, I'm going to use my lidocaine. I use the little buzzer. So the brain can only focus on so many things at one time. So we use the buzz, and then you feel a pinch on 3. 1, 2, 3, pinch. You feel small, medium, big pinch there. What do you feel? Not too bad?
It's not too bad.
If you need a break, you let me know. So for my physicians and students that are watching, how about here, small, medium, big pinch? For the deeper crease, I like to go a little bit more numbing here. Not too bad there, Tracy?
No, not too bad.
Okay, you're doing great. 1, 2, 3, pinch. And then 1, 2, 3, pinch. When I'm numbing, I like to just try and put a little dollop of the little drop of the lidocaine, and then just a quick little, the quicker you get a little tiny bit of that lidocaine, it's just a tinier pinch. 1, 2, 3, pinch. And then you can always numb more later, right? You can see it's a little sensitive. She takes a deep breath in. But this makes such a big difference. You feel pinch on 3, 1, 2, 3, pinch. And the topicals just don't numb as well when you're doing the deeper fillers. Okay, a little drop of lidocaine on the skin and then a little pinch. Sorry, a little pinch. This is a 32 gauge needle, which it is less painful. 1, 2, 3, pinch. Pinch, and then the buzzer helps. You doing okay?
Yes.
Very good, very good. 1, 2, 3, pinch. So we were talking with Tracy, and I asked her, like I ask all my patients, has she ever known somebody who can be tough on themselves? Can I tell them how you rated yourself?
Yes.
She said she was 10 out of 10 tough on herself, and I said, oh my goodness, she's such a lovely, beautiful person. And we all can be tough on ourselves. Everybody's tough on themselves. But if you're 10 out of 10 tough, is it okay to be less than 10 out of 10 tough on?
Yes.
Yeah, okay.
No.
No, she's like, I like to be tough on myself.
No, I like to be tough on myself.
Well, and you know what? You got to be strong to live in this world, but we should be gentle to ourselves. And thank goodness we have special people here who can help remind us not to be too tough on ourselves. Okay, so now, do you feel a little pinch here? Not too bad?
Not too bad.
How about here? Small, medium, big pinch? Not too bad? And a little pinch. Okay, so now we're going to build in the cheeks. We're going to build the jawline. I like to mix in a little extra lidocaine with my Bellafill because it makes it a little less viscous and it also makes it more comfortable. Little pinch there, not too bad.
Not too bad.
How about here, a little pinching? So now the lidocaine's doing its job. Thank goodness for a lidocaine.
Yes.
How about here, a little pinch? So for those of you who aren't familiar with cannulas, we use a little 27 gauge to make the entry point. I'm going to turn your head to the side nice and easy. So that way the cannula can make its way through. Brittany, I am going to need the 27 gauge 1/2 inch, please. Do you have any? Thank you so much. Do we have the 27 gauge cannulas too? Let's take a look at these with the soft cover. Yeah, that's perfect. So now, these are the longer ones. So Brittany's gonna grab that for me because I'm gonna use that for my intradermal injection. We got cannulas everywhere.
Good.
We got plenty of cannulas. We got a cannula for everything. So you make the insertion point. Do you feel a little bit of a pinch there or not too bad?
Not too bad.
Okay. I like to hold a little pressure on some of those areas. How about here? Do you feel a little bit of a pinch?
Just a bit.
Perfect. Perfect. So this one, Brittany, this one's the 22. I like the 27, okay? And so the 22 is a dark gray, but the 27 is a light gray. So yeah, but don't open that whole cannula. I need you to find those 1/2 inch 27 gauge. I think this will do it right here. This one's the one. Because I'm going to use this for the intradermal. So just be aware for these 20, there you go. See, that's the 27.
Okay.
You see the difference between these, right?
Yep.
So the darker gray, that's an important thing, right? So take a notice for you injectors. This is 27, this is 22. So the 27 is light gray, that's the one I like because smaller trauma. The 22 is a thicker, bigger, so we go smaller for more delicate injection. So that's a 22 gauge cannula. Okay, so now I'm going to start out with the intradermal. So these are the creases that really Tracy wanted to address. So now, in your intradermal, you can even see a little bit of the blanching of the skin. Do you feel a little pinch there or not too bad?
Just a little.
And then I do a vigorous massage immediately afterwards. Tiny little pinch. And those do fade away because the Bellafill, you got to remember, it's a collagen stimulator. So a little pinch, 1, 2, 3 pinch. And you can, it's really gratifying because you see it kind of plump up straight away. And we've really made a lot of progress from where we've started. Perfect. Okay. And then we've got her, can you bring up her photos? I always like to make sure the photos are up so that I can access that and see. Corner of the mouth, depressor anguli oris, depressor labii, inferior oris, bring that down, but especially the DAO. Had a great ultrasound course going through all the anatomy of the face. There's so many blood vessels in the face, which means you gotta stay subcutaneous and you gotta stay, oh, here we go. So now I'm referencing, and so if I'm looking, you come a little bit closer here. So this is where we're focusing right on here. This one right here, okay? And then you can come over on this side and watch. And Brittany, if you could grab some gauze and be over here, that way you're helping out. Thank you so much. So I'm really focusing, come a little closer, yeah, thanks. So, right in this area, and I'm just gonna do just a little bit extra. Are you feeling any pain there? Not too bad?
No.
So that crease is doing pretty good. Now we're gonna focus here on this one. This is intradermal injection. She feels a little bit of a pinch there. And in the intradermal is a very safe place to inject. You're not gonna get into a blood vessel there. That's the only place I'll use the needle. So, a little pinch. How about there? Small, medium, big pinch, not too bad? Or a little bit there?
Just
Okay.
a little bit.
Okay, you feeling any pain right now?
No.
Okay, me neither. Okay, so intradermal injections, a little pinch there, a little sensitive. I'm gonna do the same thing on the other side. Brittany, if you could hold some pressure on that for me, please. Okay, so now you see the crease right in through there, and that's a little blunted because of the lidocaine. So just a little dollop, a little aliquot of sometimes 0.3 of a c, 3/10 of a tenth of a cc, 3/100 of a cc. Just a little bit. Just a little is all it takes.
Yeah, one side always worse than other side.
Always one side worse than the other.
Yeah.
That's very normal. That's very normal. So I like to start with the intradermal injections, and then we're going to do the subcutaneous to build up. So these are intradermal injections. Everything's looking great. And then a little bit in the nasolabial fold here. A little pinch there. Pinch, sorry, a little tender. So you're gonna stay safe when you're superficial here. A little tender, that's a tender spot. Okay, good. And I like to do an immediate massage. And I'm gonna do a little bit in that skin crease as well. So I'm gonna do, there's an additional little chin crease.
I'm so excited.
Me too. I'm so excited. Notice that little crease here, so you feel the buzz, and then you're gonna feel pinch on 3, 1, 2, 3, pinch. Sorry, a little tender there. That's a tender spot. Okay, that's sensitive. Let's give her a little break now. We'll give her a break. So we'll go easy, yeah. You'll feel that ease up. Now, while that's settling, I'm gonna do a little bit for the back of the jawline. Very good, very good.
It's so good. It's so good.
There you go. All right, so now you stay on that side, Brittany, and I'm gonna stay on this side. So I'm gonna turn your head to the side a little bit and a little bit more. Turn, turn, turn. There you go. So I'm gonna find that little entry point where we started. Twist, twist, twist to atraumatically. Now, when you're using the twist technique, it is more difficult to get into vessels. So, small, medium, big pinch there, not too bad.
No.
And goodness forbid, if you're in a vessel, if you do a small amount over a large area, you are going to, you're not going to put much even if you do get into a vessel. So. Obviously, the goal is to stay out of the vessels, but safest technique. I think those ultrasound location devices are really powerful. Let me turn your head this way. And a lot of doctors are talking about it's difficult for it to be practical because to have that ultrasound device while you're manipulating the cannula can be a challenge, but I applaud the technology. I think everybody should take Dr. Weiner's ultrasound course. Small, medium, big pinch there.
Just small.
Okay, so we're strengthening that jawline here. I like the subcutaneous, just blending that area in. Perfect. Okay. And that helps us out. A little massage. Now, I'm going to go back to that other little crease. There's no restrictions after the Bellafill. Let me turn your head this way. Thank you very much. Do you feel a little bit of a pinch here? Not too bad. You can see that immediately fill up, which is great. Now, even if you feel that little tiny bump, you can massage through that and it flattens very nicely. Because remember, the collagen is going to get absorbed and replaced by our body's own collagen. So this is you can't get rid of all the creases, but you can make them better.
That's what I say.
There you go. That's a healthy attitude. I mean, listen, on the inside, we're all perfectionists. We can be tough on ourselves, but there's a limit on how far we go. So, and the result does get better over time because Bellafill is a great collagen stimulator. Okay, just this last little bit there. So that's that area. Now I'm going to do a little tiny bit here, a little pinch, sorry. And a little bit, sorry, a little tender. It's a little tender.
Just a little tender.
And then a little bit in the corner of the mouth. So we're going to build this up directly 2 different ways. Intradermal injection and then subcutaneous. I don't think injecting in the muscle in this area, I'm not a fan for that. Let me turn your head this way. And then we're really trying to address these little areas. So we're going to thicken the dermis. Feel a little pinch through there. This is intradermal. I got a little resistance on my, there we go. Very good. Can you back out just a little bit, Suzanne? There we go. Okay, so I like our progress. Tracy's gonna pass the grocery store test today. If she walks into the grocery, nobody does a double take. Little pinch there. How about now? You feeling any pinching?
Just a little bit.
Just a little bit, okay.
Not a lot, just a little
We try and keep it, make it easier than the dentist's office.
Yes.
A little bit here, a little pinch, a little pinch. Okay, perfect. And Brittany, if you could come on this side for me, please. Thank you, Brittany. Very good, very good. So now we also want to address this nasolabial fold here. A little pinch there, a little pinch. This is intradermal, right, subcutaneous. That is the safest place to treat. Little pinch here, little pinch. You're doing great. And then this corner of the mouth here, that's an important spot to make sure we get a little bit there. So I'm gonna blend a little bit more here to help get a little projection of the chin. We're gonna do some in the cheek as well. We're coming right along. I've got a tiny bit. We use every little drop of the filler. And I'm just looking at her smile lines there. Just do a little tiny bit here. There we go. Okay, so now, thank you for watching. Thank you for sharing. We put a face continuity plan for everybody together so you know the right options. You need to know your ABCs of plastic surgery so you make your best decisions. Let me turn your head this way a little bit. And now this is a little more of the subcutaneous. So, and turn for me just a little bit more. Thank you very much. Perfect. Twist, twist, twist. You feel a little pinch there? Not too bad?
No, not too bad.
Very good. Cannulas are great. So this is the deeper injection where it's much safer to use that cannula. So we're doing this for collagen stimulation. We're doing this for reinflating the facial contour. Very good. Small, medium, big pinch. Not too bad there.
Not too bad.
So it's just good. We lose volume consistently. This is the pre-jowl sulcus, melolabial fold. We're going to focus a little on the cheeks. When I'm injecting the cheek, I like to stay about 10 millimeters below the inferior orbital rim. Everything's looking great. Very good.
It's
Very
looking
good.
good.
Yes, it's looking good. It's looking good. All right, so twist, twist, twist. So if you want to stay out of vessels, although the anterior cheek is very safe, people get into trouble with the inferior orbital foramen. Pressure pinch, pressure pinch. A little bit of numbing, a little bit of hydrodissection. So this is subcutaneous. Twist, twist, twist. Little pinch. Staying about 10 millimeters below that inferior orbital rim. You're building up the cheek. That cheek area gets hollow.
Why does that get hollow?
Yeah, it's a good question. We lose skin, we lose fat, we lose muscle. We also lose bone as we get older. So, but we can put the volume back. But that just happens. If we're lucky, aging keeps coming for us. So we like to, if patients are on blood thinners, we tell them to stay on them. Motrin or aspirin can make us bruise a little more easily. So we try to avoid that. Perfect. Everything's looking great.
Good.
They're looking good, looking good.
That's when I saw you on a video. I thought,
Yeah, everything's looking good.
Yeah, I thought, I'm having this guy.
You're so sweet. Well, thank you for watching our videos. We're doing our best to keep people out of trouble because people are doing a lot of treatments out there and getting into trouble. We want to keep them safe.
That's why I come to you.
Yeah. Now, here's I'm going to show you. Let me show you what we've done because I've got a little bit left. So let's take a look together. So hold this for me, please. We're not done yet, but first of all, we really focused on these areas here. A little bit of bruising, that's going to go away.
Oh my God, yeah.
You see how the jawline gets stronger?
Yeah.
What I'm thinking is maybe just a little bit more in the cheek and a tiny bit on the jawline. Is that okay for you?
Yeah. Yes.
Yay for Tracy.
It's looking good.
It's looking good, looking good. All right. Okay, very good. So we're in Tampa and the Villages, Florida. We have the best team, we have the best patients. If you're just not joining, I'm Dr. Rich, double board certified facial, plastic, and reconstructive surgeon. Done over 4,000 facelifts under local anesthesia, over 20,000 syringe injections of filler. We have our master injectors here who are really awesome. How about here, small, medium, big pinch, not too bad?
Not too bad.
So this is a very safe place to inject now, but it's the technique. It's not where you inject, but how you inject. Feather touch. I'm just doing such a light little press on the plunger of the injection of the syringe. Tiny, tiny bit.
I'm so excited.
I'm excited too. I'm so excited, and I just can't hide it.
I'm about to lose control when I'm thinking. Sorry.
You're doing great. You're doing just fine. All right, here we go. Now, under the eyes, it's important if you ever take Zyrtec, Allegra, Claritin, if you have allergy symptoms, I'm going to turn your head to the side, recommend people see an allergy doctor because it does help with reducing allergy symptoms. Now turn your head this way for me and turn, that's good. So I'm just going to blend just a little bit more here on the jawline. Perfect. Tiny pressure, tiny pinch there. Perfect. Strengthening that jawline. We follow the hollow, as we say.
Oh, that's a good one.
Follow the hollow. Perfect. Good. Let's turn your head this way just a little for me. Thank you very much for Miss Tracy. 5-minute massage 5 times a day for 5 days. You can't hurt the product. If you feel a firm area, you can massage it down. Usually time and massage will settle any firm areas.
Can I put ice on when I get up?
You can if you'd like. Yeah, that's fine. And we'll give you some ice.
Yeah.
I'm going to grab some ice for her, Brittany. Let me turn your head a little bit more to the side. So sometimes there you go. And that's that little turn of the head, and now things were just a little more easy to progress. Okay, so hopefully we're completely done. Hopefully that wasn't too bad.
It was awesome.
Yeah, there you go. So I like what I see. We're gonna get some pictures of you straight away. Much better here. And then this, you of course you got the great smile. I love it too. I'm gonna give you a hug. So proud of you. So proud of Tracy.
Thank you.
Okay. You're very welcome. Thank you all for watching. We're gonna have more videos coming soon. Now you take a look here. I'm gonna show you. These are our little creases that we were really focusing on, and I'll bring this, and you can see that the creases fill out nicely. We can't make them gone. Stronger jawline. So that's what we want out of the fillers. We'll see you in the next video. See you later. And if you hit those little buttons, then it'll stop it on both sides. You're on this one here, X, and then